Hello, everyone. I'm Marcela Varela. I'm a proud mother of a boy that is 9 years old. Nicholas was born with normal hearing and used to speak with his grandmother on the phone daily. And 2.5 years old, his preschool noticed that he wasn't following instructions, and at home, he no longer reacted to the shout of goal during the 2018 World Cup. And when he was taken for a hearing test, a 30% hearing loss was discovered, despite the previous normal diagnosis. After several tests, ventilation tubes were placed and he began using hearing aids. However, his hearing continued to deteriorate rapidly, and during a consultation with the ENT specialist, significant hearing loss was confirmed, and his right ear and a cochlear implant was recommended. He received the implant in June 2019, and today, 5 years later, Nicholas hears again and lives a normal life, which has been a miracle and a blessing. Next slide, please. We live in Colombia, South America, in the capital, in Bogota. We have 50 million people. We speak Spanish. We have some landmarks, the Amazon jungle, Bogota, the Coffee Triangle. We are famous for Colombian coffee, Colombian arts and artists, diversity of flora and fauna, and emeralds. Next slide. We have, now let's talk about health services in Colombia. The government in Colombia we have coverage of the diagnosis, surgery, the cochlear implant, and post-implantation services, but they don't pay for the consumables. We have the support, we have assistance in administrative procedures and psychological counseling. We have also the universal neonatal hearing screening law for all the babies. And we have post-implant services also, technical support and advice on post-implantation services, national coverage, and telemedicine services. Nowadays, we have a problem because the government wants to change all the health system in Colombia, and we have uncertainty health system with some changes and access barriers. Next slide, please. Thank you. Our principal challenges and barriers in Colombia are in the diagnostic barriers. We have limited access to diagnostic tests. We have insufficient trained personnel. We have economic barriers like inequality in access. We have costs such as travel to specialized centers in remote areas. We have administrative barriers also, waiting times for paperwork and authorizations, almost like a year or 10 months to wait for that. We have unknown regulations by healthcare providers. We have also technical and medical barriers, availability of specialized centers, device maintenance. We have also barriers during post-implant rehabilitation, access to hearing rehabilitation therapies, continuity of rehabilitation, and low levels of family and social support. Psychological and social barriers also we have stigmatization, emotional adaptation, social and schooling inclusion. And we have a lot of barriers in information and education barriers because we have insufficient information to patients, their families, and educators. Next slide, please. What do we need in Colombia? We need health awareness as a fundamental right. We need collaboration with patient associations that offer support, legal guidance, and education for the community. We would like to have cochlear implant users. We have like a tutela action, a legal recourse to demand immediate access to health service, but we need more help with that. And we would like to have participation with patient organizations to strengthen the collective voice and help make problems visible to health authorities. Next slide. Thank you so much for the invitation.